So we apply the SDF, and probably a year in, I kept saying, oh my goodness, the plaque is not sticking anymore. Their gums aren't bleeding as much. And it was very interesting to hear Haley say that it does not allow the biofilm to adhere, because I've been saying this for a few years now, and it's just one of those things that there isn't enough research, or wasn't enough research at the time, and it's so rewarding. So this person obviously went out and had some root surface fillings placed, resins there, and still recurrent decay. And so the family member said, well, we've already taken them out and done restorative, and they still got decay. So what can we do now? And this is what we did, and totally fine. The person, no pain. You can see the molar, I believe it's the first molar there, it might be the premolar, just all the way cavitated into the root and no pain at all. So we'll go to the next slide, Brooke. This one, this was after treatment, and we do more of a generalized application with the SDF because we tend to see the lesions on almost every tooth in this setting, or little tiny incipients on a lot of the roots at least, plus for the gum health reason. So you can see how the gums are a little bit white around that cervical margin of the tooth. We do isolate with the gauze, and we put a little chlorhexidine on ours to kind of trick their mouth from the taste of everything. But you can see the white on those gum tissues afterwards. We'll go to the next one. This is the more severe case, but once again, just not much plaque on those teeth when there's all the surfaces to stick to. This one here is very interesting because I have read, and I will definitely be in touch with Haley to ask some more questions, but I have read that you should not be placing it on pulp exposures. And when we have a patient that we're seeing and the medical doctor is saying absolutely no extractions, we do sometimes place it on a pulp exposed tooth, or we will place it in an abscess area, because it's better than doing nothing. And we've had really good results with that. So you can see the applicator here is a few millimeters up there getting a root tip. And this patient has numerous root tips and no pain in their mouth. This is a patient who wanted dentures, and big Mountain Dew drinker, root tips. His health did not support full mouth extractions, and we're able to arrest the decay. He still has his ridge, and so he had a denture made on top of that. This patient, look at the health of those gums, and that's what I just absolutely love. Is we clean this patient's teeth, but no inflammation hardly at all. And this was also a second or third visit. So he had already had a few visits of the silver diamine, but you can see his beautiful white crowns. You can see the black. A family didn't care, patient didn't know, but the gum health was just amazing to me. This is just a mesial surface broke all the way down to the root, and family said, just go ahead and do that. We also placed it around the gold crown because you can see incipient there. Same thing here on this patient, all root caries, almost every single tooth in the mouth, but healthy gums. So this patient was another patient that went out to a dentist, and the wife was able to get him there, but it wasn't, just taking him out of the facility was a little too much for him. And the dentist did a great job applying some resins on some recurrent decay, but within just a few months, some of the resins had already popped off, and you can see all the additional lesions from just like 2 months after being treated at the dental office. And she said, I just can't have a successful appointment taking him out again. This patient, no pain in their mouth when we first saw them, but needed some care, obviously. Medical doctor said, the patient, we don't support extracting those teeth at all. Don't do a referral. And I said, well, I'm not going to not do anything. And so silver diamine is what it was. This patient is still like this over a year later. And what our team has found is in a lot of these facilities, it's hard to find dentists that are coming into the facilities regularly. And so we get asked by the medical doctors a lot, different things. And we'll have dentists that we do communicate with off site to ask their opinion on different antibiotics or different treatment options if extractions aren't an option. And a lot of times the dentists that we contact, as well as the medical doctors, will recommend silver diamine and a round of antibiotic and monitor. One more there. This patient was 103, and I had seen her. I got a call from her family member and from the facility saying her breath was just atrocious and she had walls and walls of tartar. And her daughter took such great care of her. She had me see her once a month, and I saw her once a month for a little over 2 years until she passed away. And we were able to maintain all these areas. Not one tooth broke off to the root tip. Same patient there. And Brooke, you can probably scroll up. Okay, these are the last two we really have to go through. So go one advance from this, Brooke. There we go. This is a patient that had also just been out to the dentist, and it was actually a dentist I had worked for years. And this patient had financially was able to do everything he wanted to his mouth. He just was mentally not able to allow people to help him care for his mouth anymore. And his wife said, if I take him out, it's not going to be successful. So he did have the resins placed on a few of these teeth a little before I saw him, but just walls of tartar and then demineralized tooth surface. And I've had a lot of hygienists ask me, will a demineralized tooth surface turn dark or black? And from my experience, if it's demineralized, but it's not cavitated all the way through, it usually turns like a yellowish color or a little different color, but it's not black. It's more where it has gone through the enamel and into the dentin where it will turn black. So if you go back one slide, Brooke, you will see the same patient and what happened when I applied it then. So you can still see down below, like in the middle third of the tooth, you can see the white demineralized areas. So now that has been remineralized just by putting the silver diamine on, but it didn't turn that whole tooth black. It just turned the active cavity lesion black. So I think that those are the only slides we need to see. Some of them are a little more repetitive, but once again, look at that tissue health. So it's pretty amazing. And I've had a few hygienists in private practice that actually have started to apply it on furcations and difficult areas to clean on patients just in general practice. It's amazing. So thank you for letting me share.
Thank you for sharing that, Sarah. I mean, your pictures are worth 1,000. Send it to you to talk just a little bit more on SDF from your perspective.
Thanks, Brooke. I just wanted to kind of wrap it up and say a few words about it. For years, we used SDF in Minnesota at the program I ran. We went into high schools, and we were a nonprofit charity. And so this was really an answer to prayer. We worked with dental therapists. We worked with the collaborative practice dental hygienists and volunteer dentists to really give as comprehensive care as we could to these high schoolers in Minnesota. And I mean, we would leave the week with hundreds of applications of SDF, and the results that we saw were phenomenal. One of the tricks that we kind of found works best when applying it in a school situation is to, on your form, is to have an opt-out form for SDF instead of opt-in. So there's different, you have to weigh that with your organization, whether or not you want to do it that way. But that's one of the things we found success. And, we were still communicating with patients and the patients' caregivers and parents. And that was something we found very successful. And also a bit of advice that I heard from someone, I'm not sure who it was, but they told me, Melissa, be careful not to assume that your patients won't want this. So when I worked with this in private practice, in a non-public health scenario, I need to assume that I'm not making the decision for my patient, right? So like Sarah said earlier, she applies it to herself and weighing the pros and cons of the darkness versus letting the cavity grow. I've applied it to myself a billion times. So we just, as providers, I think it's very important that we don't assume that our patient will not want it. How many times have they said yes to amalgam, right? How many times have they said yes to a gold crown or to a PFM? So it's these situations that we need to navigate carefully. And I'm just excited to get this new code going. So thank you to Alyssa and Sarah and Haley for sharing tonight. Brooke, I'll turn it back to you.
Thank you, Alyssa. And thanks for sharing that. Before we finish up, you guys, if there's any other questions, just put them in the chat and we'll try to get them answered for you in these last couple of minutes. I'm going to send it to Thomas Lovinger. He's on the call and he's just going to talk just for a second about membership.
Thank you very much, Brooke. Thank you for putting on this great event. Very proud sponsor AMTA is of this event and events like it that you do. One of the many benefits of being a member of AMTA is events like this and networking with great people like this. And so right now we have our foundational membership pricing going on, and we're forming an alliance of mobile dental care and teledentistry providers to improve regulations, fight for fair reimbursement, and get attention from vendors like Elevate to make products that fit our needs, and many great things going on. So now's the time to join. $99 foundational membership going on through the end of the year. So hope to see you all there in the Alliance. Thank you, Brooke.
Thank you, Thomas. And thank you everyone that shared tonight. I think that this was a topic that I was really excited to hear about, and the new code coming out that Haley shared about, we're really excited about that in our community health center setting. I think it's a code that we will be using a lot. And thank you to Sarah and Alyssa also for coming on and sharing with us. And thank you guys for joining us. If there's any other questions, reach out to us, and we look forward to talking to you guys soon. And like Melissa said, if there's any other topics that you guys want to hear about or come back to and revisit, go back through. If there's any other topics that we started on, we've done some roundtables on school-based care and the nursing home setting. We've done several conversations. If there's something you want us to come back to, maybe there are some things that now we might want to go back and talk a little bit more on. Let us know what you want to hear about. But thank you guys for joining us on this Monday night. It was good to see you all. Have a good week, you guys.
Of good conversation around silver diamine fluoride. And talking with Brooke a little bit, I understand that this group is pretty well versed with silver diamine fluoride. So I'll give a quick little history into it, go over quickly some of the uses, and then I'm going to spend some time talking about an exciting new billing code that will be available in the month or so, and some information and research on as to why that code is becoming available, and another way that you can incorporate silver diamine fluoride. So go ahead and go to that next slide, Brooke. And let's see here. I don't think it's changed on my end just yet. I'll just keep talking here while it's getting ready. Just so you guys know, the silver diamine fluoride that is available from Elevate Oral Care is called Advantage Arrest. It was the first silver diamine fluoride here in the United States, and it's made here in the United States as well. It's a 38% silver diamine fluoride solution. And just to kind of give a little background into silver diamine fluoride, it is still a fairly new product here in the United States. It launched here in April of 2015. And in a moment here, you'll see a lot of different research that's available on silver diamine fluoride. I mean, it's very hard to pick up a dental journal or article now without reading some information about silver diamine fluoride. And there's just a lot of different ways that it can be used. It's been used in other countries for a very long time. Japan, for example, has been using it for over 50 years. And in that time, there has not been a single adverse event reported. So it's also an extremely safe product to use. And Brooke, go ahead and jump to the next slide there. Perfect. And as I was saying, there's lots of different ways that you can use silver diamine fluoride. It's FDA cleared as a dental hypersensitivity treatment, which is the same way that fluoride varnishes are cleared. But the most common way to use it is to arrest caries, and we'll talk a little bit about that today. And then it can also be used around existing restorations. So if you have a patient that has developed some recurrent decay, it can be applied right around the margins of any existing restorations to arrest a patient's recurrent decay. It can be used as a liner under new restorations. An exciting way that we'll talk a little bit further about today is you can use it as an occlusal barrier like a sealant. And then also we're going to spend a bit of time talking about prevention and how you can use silver diamine fluoride for prevention on high-risk sites. And, you know, if you are familiar with silver diamine fluoride or you've heard anything about it, you've probably heard of that discoloration that will take place in the tooth surface, kind of like that picture on the bottom left side of the screen there. And this will not stain if you are applying this to healthy, sound tooth structure. So keep that in mind as we talk about the preventive uses around silver diamine fluoride today, because you do not have to worry about that discoloration if you're using this on that sound, healthy cementum, enamel, or dentin. So let's go ahead and go on to the next slide here. This was one of the covers that you saw on the previous slide, but this was exciting. This was the cover of JADA in October of 2018. And as you guys can see up top there, it says that it's a report from the American Dental Association, and it's titled Evidence-Based Clinical Practice Guideline on Non-Restorative Treatments for Carious Lesions. So this article was huge for silver diamine fluoride because this is really the first time the ADA has ever come out and said that you do not need to restore over a carious lesion. So there's a lot of great information in this article on lots of products that we use chairside with patients, but there's also some great information in here on silver diamine fluoride. And they developed two flow charts that really summarize the article. So if we click on the next slide here, it will show you the first flow chart, which as you can see up top, this one is for primary teeth. And on the very next slide, Brooke, you can click on that one, is for permanent teeth. And what the article does and what these flow charts do is they break it down to whatever surface that carious lesion is on. And then of each surface, if you're dealing with a non-cavitated lesion or a cavitated lesion, this walks you through what the ADA's non-restorative treatment recommendation would be for that patient. So what you can see here on this slide, which is the permanent teeth, if it's a cavitated lesion, the only non-restorative treatment recommendation down there at the bottom is silver diamine fluoride. And if we were to jump back to that permanent flow chart of the permanent teeth, it's the same story. If it's a cavitated lesion, the only non-restorative treatment recommendation from the ADA is silver diamine fluoride. So a lot of great information, and there, right there is the ADA giving you these guidelines on how we can implement silver diamine fluoride in these caries arrest situations. All right, go ahead and click on that next slide for me, Brooke. And this one here is, when it pops up here, is going to show you the different forms that we have silver diamine fluoride available. For those of you that have used it before, you may have seen the 8 milliliter bottle that we have in the center there, which is our bulk option. And then we also came out, after we had that bulk bottle for a while, we had a lot of requests from certain clinics and offices where they needed to have that unit dose option or preferred a unit dose option. So then we came out with the unit dose, which is what you can see on the right-hand side of the screen. And then just last week, we launched our new little 3-bottle kit. So this one is really exciting. Again, when COVID hit, we had a lot of requests from offices to have a smaller bottle that could easily be stocked in multiple operatories to reduce possible asepsis, and just to have this more readily available now since we have hygienists using it daily, as well as the restorative team. So this way, it comes in 3 bottle kit of these little 3 milliliter bottles. So that way you can easily stock them in multiple operatories. Which has been a really exciting thing that we recently came out with and it is now available. And then for anyone that has not used it, it says it's now tinted. It's been tinted for a while now, but it has that nice blue tint to it, so you can really see where you're applying it to. And just to kind of give you the breakdown here, as you can see, it's a 38% solution. So the rest of it is just all water, but that 38% breaks down to 25% silver, 8% ammonia, 5% fluoride, and then less than 1% is just the blue dye that's used to tint the solution. So the silver in it is the antimicrobial agent. So that's what's actually killing off the bacteria in the lesion. And then it also helps to prevent the formation of new biofilm throughout the entire dentition. And the fluoride's job is to promote remineralization in the tooth that you're applying it to. And it too helps to prevent demineralization throughout the entire dentition. And then the ammonia is in there just to stabilize the silver and fluoride in the concentration together. And if you've never used it before, this has a very thin consistency like water. You may notice a little bit of a Windex smell to it from the ammonia in it, but you use, such a small amount that patients don't typically pick up on that Windex smell, but they will pick up on a little bit of a metallic taste to this. And in a moment here, we'll go through the application on the next slide, and we'll go through, you can mask that metallic flavor for the patient. So go ahead and click on that next slide for me, Brooke. And this one here is just going to walk you through the application, which we talked through all the different ways that you can really utilize this. And really the application is pretty similar and the same no matter how you're using it. So you do just want to clean the site first, and that's just simple plaque removal or any kind of food debris removal. And then with the Advantage Rest, you only need to just simply cotton roll isolate the area. And then you want to dry the site, apply the silver diamine fluoride, and ideally you want to let it soak in for about a minute. And then after the minute's up, you're just going to cover over the area you just treated with fluoride varnish. And that fluoride varnish step is really one of the most recent additions to the application process. And that's really coming from a lot of different key opinion leaders who research and use this all the time. And they have found that by applying fluoride varnish over it, it acts as a little protective layer or seal so that the silver diamine fluoride can continue to work undisturbed for a little bit longer period of time. And then that varnish step is what the patient will really greatly appreciate because this has that pretty strong metallic flavor. So the varnish will really help to kind of mask that metallic flavor for the patient. That's kind of nice. You guys can see on the screen there, we've got a picture of our FluorMax varnish, which is available in a unit dose option, but that bottle system that you can see on the screen there is really handy to use in conjunction with the silver diamine fluoride. I'm going to talk a little bit more about the preventive benefits of SDF here in a moment, but anytime you're using silver diamine fluoride, it is always going to be a site-specific application only. So if you apply this to an area that you're treating, whether it's for a lesion or for sensitive area, if that patient is not going to be receiving a full mouth fluoride varnish treatment that day, you can just dispense this out by the drop. So that way, if you just need a drop to cover a few sites you treated, you can just dispense that single drop. And then to do a full mouth application with FluorMax in that bottle, it's like 1 drop for a primary dentition and 2 drops for a permanent dentition. And it breaks down to about 16 cents a drop. So it's incredibly affordable. It's for a primary dentition, you're looking about 16 cents for that fluoride varnish application and about 32 cents for an adult. So it pairs very nicely with the Advantage Rest. But let's go ahead and go on to the next slide here. So this is where it gets kind of exciting. There's quite a few different billing codes now that are available to be used with silver diamine fluoride. And I'm actually going to start here on the second bullet point on the screen. Since a lot of people are used to using this now to arrest caries, there's that code that's been available since about 2016. It's the D1354. So anytime you're using this to arrest decay, that's the code you'll use is D1354, which is a per tooth code. And, since that launched just a few years ago, it's still a fairly new code, so not everyone is covering it yet, but we have seen about a third of private insurance plans covering it, and over half the state Medicaid programs are covering that as well. So we're definitely seeing that coverage pick up. The third bullet point down there, if you are using this as a desensitizer, it's the D9910. And then the final bullet point there says just through December 2020, so through the end of this month, if you were to be using silver diamine fluoride for prevention, the code was to just use D1208, which was just a fluoride application. But that's where it gets pretty exciting. If we jump back up there to that first bullet point, effective January 1st, there will now be a code that is going to be pretty much specific to using silver diamine fluoride for prevention. And you can see the nomenclature of that code there is a caries preventive medicament application, which is D1355. That too is a per tooth code. So very exciting. You can now use this per tooth for prevention. And like I said before, anytime you're using silver diamine fluoride, this is really always going to be a site specific application. So you can site specifically apply it to active decay, those sensitive areas, or high risk sites in that patient's mouth. So when you're looking at that patient who may be moderate to high caries risk, if you were to kind of pinpoint the areas in that patient's mouth where you think they would be most likely to develop decay, those are the areas that you're going to want to site specifically apply the silver diamine fluoride to. And then you can still do that in conjunction with a full mouth fluoride varnish treatment. It's perfectly safe to use those together, and they can be billed together as well. So you can bill both a 1355 and a 1354 in conjunction with your 1206 fluoride varnish code. So that's an exciting update about silver diamine fluoride. So let's talk a little bit more about the preventive benefits of silver diamine fluoride. So let's go ahead and click on the next slide here. This was a great article that came out, as you can see in the fine print up on the top right, March of 2019. It's been relaunched now due to that new code that's available. But this is titled Prevention of Dental Caries by Silver Diamine Fluoride. And Brooke, if you want to go ahead and jump to the next slide as well. This has a couple of the key takeaways from the article itself. And when we're finished in the chat box, and I actually think I even have a slide, I'll put my email up there. So I'm happy to share these resources with anybody afterwards if you're interested in reading through these. But as far as the bullet points go here, I'm just going to read the bottom bullet point, which says SDF should be placed on the highest risk surfaces as a priority. And it's very interesting. As you read through this article, it explains what's happening to the tooth when you're applying it. And it says that the silver diamine fluoride is creating antimicrobial tooth structure, so bacteria cannot colonize or demineralize. So by applying this, you're really turning the highest risk sites in the patient's mouth into the safest site in that patient's mouth. So it's very beneficial to use it that way. And I'm going to read you guys one other quote here that came out of a separate article. This was out of the California Dental Association Journal back in January of 2016. And there's a whole section of that article that's also dedicated to the prevention that's seen with silver diamine fluoride. And it says here that annual application of silver diamine fluoride prevented many more carious lesions than 4 times per year fluoride varnish in both children and the elderly. So by applying this one time annually to a patient, they're seeing greater prevention than if we were to treat a patient with 4 fluoride varnish treatments in a year. So again, just site specifically to those high-risk sites, and you're offering much greater prevention than any other fluoride varnish or any other fluoride treatment does. All right, let's go ahead and go to the next slide here. This is a really cool image that I like to share a lot. So you may have seen this. Is a micro CT scan that's showing the dental penetration of silver. So all of those little pinkish lines there are where the silver has basically formed these silver rods through those tubules. So you can imagine what that does for sensitivity relief for a patient. As we talked about in the beginning, this is a great desensitizer. And then think about it, you know, oftentimes where patients complain of those sensitive areas are going to be those exposed root surfaces. Well, that's a high caries risk area. So we can apply this to that surface, treat their sensitivity, and offer prevention to the area. Again, it will not discolor that surface. It's a sound, healthy tooth structure, but this way we're treating their sensitivity and offering that prevention to that high risk area. So it's a really great way to use it for some of our older patients that we see with these complaints. All right, let's go ahead and jump to the next slide here. This is a great way if we think about some of our younger patients where we look to do sealants or some kind of an occlusal barrier. This is a CT scan that's showing silver kind of sealing in these fissures. So one of the ways that I mentioned that this can be used in the beginning is really as an occlusal barrier, very similar to a sealant. And now it's not going to be like a sealant where it's filling in those little pits and fissures, but it's you're applying the silver to these occlusal surfaces. It's penetrating deep into that tooth surface, and it's creating that tooth structure. So the picture on the left here is before the silver diamine fluoride has been applied. And then the picture on the right is obviously after the silver diamine fluoride has been applied. I can't share my cursor, but if you look
at solar panels
areas there, deep down in those little pits and fissures, you can see where that silver has just penetrated to the base of those little fissures, creating that antimicrobial structure deep down in those little pits and fissures. So great option for children that can't sit through sealants, that maybe you don't have that sealant capability at that time, or a child with primary teeth where their insurance isn't covering it, but they are at risk. This is a great, just every 6-month application to offer that prevention to those occlusal surfaces. All right, let's go ahead and jump to the next slide. And this just shows you what you can expect it to look like clinically, pre and post treatment there. I mean, hardly any color change whatsoever, and you've offered that huge benefit to that patient. All right, go ahead and jump to the next one. Perfect. So that was a lot about prevention. Now, you know, a lot of us have used this to arrest carious lesions as well. And you absolutely can restore over those areas. And we'll talk a little bit about that in just a moment. But if you don't restore over these areas, this has a full mouth benefit to that patient, because once you have that little stained, arrested lesion in that patient's mouth, it will sit in their mouth and it acts as a reservoir of these silver and fluoride ions. So it will actually continue to offer prevention throughout the patient's entire dentition. So just to kind of quote that California Dental Association article again here, it says that when bacteria killed by silver ions are added to living bacteria, the silver is reactivated so that effectively the dead bacteria kill the living bacteria in a zombie effect. This reservoir effect helps explain why silver deposited on bacteria and dentin proteins within a cavity have sustained antimicrobial effects. And that's what this quote on the screen here is demonstrating, that the prevention from these arrested lesions after 2.5 to 3 years, 70% fewer lesions are observed on untreated surfaces of patients whose lesions were treated with SDF. So it's really fascinating, this full mouth benefit that comes along with this. All right, Brooke, next slide, please. And this is some fairly recent data that came out. Says that SDF significantly decreased gingivitis in geriatric patients in 3 weeks. So the conclusion of this study said that our results provide tangible evidence that SDF application is associated with better gingival health. SDF has the potential to be a new adjunctive, cost-effective, and non-invasive tool for treating gingivitis, which I'm sure some people can attest to who use this regularly. You know, you can apply this, site specifically to a tooth that you're treating. And if you looked at the inflammation around that tooth that you treated at the time you treated it, and then when you see that patient back in a few weeks, you would see an improvement in the inflammation in that soft tissue most of the time. It's pretty fascinating to see. All right, go ahead and jump to the next slide here. And this is something that a lot of you may be familiar with, the smart restoration. So as I was saying before, you can restore over silver diamine fluoride. You can restore over it as early as the same day, or you can hold off on placing a restoration over it. One great way to restore over it is what's called the smart restoration. And SMART just stands for silver modified atraumatic restorative treatment. And that allows you to apply silver diamine fluoride to arrest that infection in the tooth and restore over it without the need for any local anesthetic or drilling. And also what's very important in this current time we're in with COVID, it's also a non-aerosol producing procedure, which is just fascinating in itself as well. So keep that in mind. And I think that's pretty much it, Brooke. If you want to jump to this slide, is just showing the product we discussed was the Advantage Rest. That one is sold directly from Elevate Oral Care. A big thing in the difference between Advantage Rest silver diamine fluoride and the other silver diamine fluoride that's available in the United States is if you look at that pH and barrier line in the center there. Advantage Rest, like I told you guys, it's very safe. It's if you apply it around soft tissue with either of these products, you can get a little temporary soft tissue discoloration. It goes away in just a few days. But that's the only concern with Advantage Arrest because it has a pH of 10, whereas Revastar has a pH of 13. So it does require a gingival barrier being in place like a rubber dam. Otherwise, you can see some pretty serious soft tissue burns with that. And then price point is quite a bit different. The Advantage Arrest, you can get a good cost savings per either bottle or unit dose compared to the Revastar and a little bit longer shelf life. And then just that next slide, Brooke, is where we can end it here. And if you guys are interested in getting some more information, my email's down there at the bottom. I'd be happy to share any of the resources that I went over. And then in the center there is a link to our website. We do have a team of preventive care consultants across the country who would love to either come in office or do a virtual event with anybody who has any more questions or would like some more information. So check us out at elevateoralcare.com.
Thank you, Haley. That was awesome. Now, let me just stop sharing here. I mean, your products are great. And I think that you hit on so many topics that so many of us on this call, whether it be school-based programs or kids that we're working with or in the nursing home facility, so many of us on this call, that's the population we're working with every day. So that was great. That was great to hear that. Thank you for sharing that. And, you know, like you said, right now, when we're all focusing on non-aerosol generating procedures, it's great to be looking to SDF as an answer. And I'm going to send it over to Sarah Lukey, and that's a perfect segue. She's going to talk a little bit about the way that she's using SDF in her practice. And let's see, Sarah, you can unmute yourself.
I believe I'm unmuted.
Hey, you are.
Okay.
You sure
and
are.
I'm not sure how to share my screen with you.
I'm going to make you a co-host right now, so you should be able to do that. Okay.